Dimple creation. I need to know the pros and cons. How do you feel about dimpleplasty? I really have a fetish for them, but it is my face. I need to know the pros and cons before I proceed any further. Help.
Thank you for your question. You submitted your question without a photo, and essentially it appears that you're very interested in having dimples and to undergo dimpleplasty. You state in your question you have a fetish for them, but you also are concerned about the pros and cons, and you want to learn more before considering a consultation. Well, I can certainly share with you how I counsel my patients who are considering dimpleplasty. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've actually become very well known for dimpleplasty. It's a procedure that I found has becoming growing in popularity, and interestingly, we've been featured in some media, and patients come here from everywhere for dimples. But that being said, I do spend a lot of time counseling my patients about the pros and cons about dimpleplasty. So let's begin with first understanding essentially what I feel has been a common characteristics among patients who come for dimples. And that is that they really love the idea of getting dimples. They often have situations where they'll say that their siblings have dimples, and they've always envied the particular sibling or siblings who had dimples. They have looked at particular stars and famous people who have dimples, and they just think that they really are great. And then they do spend a lot of time showing me pictures on their phone about of different people that they admire, whose dimples they really like, and then ask if they can get the same one. So certainly for the right face, I think dimples has an impact and can be very positive. Often, when I do my consultations, I will often have more of a neutral position, and I'll say, well, do you really want to have dimples, and what is it about dimples that you really think are really good? And then what I'll do for them is show them where anatomically nature would have potentially created a dimple. A lot of times people think that dimples are much higher on the cheeks than they really are. There's a particular area in the cheek which is essentially what I refer to as the sweet spot. It's a place where it's an area where there's no statistically significant nerves or blood vessels or other things that could potentially be problematic, with the exception of the salivary duct, the duct that transports saliva. But essentially there's a one spot, and when you go higher, then it doesn't really, it's not exactly safe, nor will it hold. And if you go lower, it won't look very good. So when I showed them where that sweet spot is, and I place marks, and then I have them hold little Q-tips to push in those areas, and we take pictures, and we have them smile, and we show them where that would be. Once the patient says that this looks good, this is what I want, then I explain to them the following. Number one, it is a procedure where essentially what we're doing is we're creating surgically a connection between a muscle on the inside of the mouth called the buccinator muscle with the skin. And the approaches can be from the inside or a combination approach from the outside and the inside, depending on the anatomic advantages. People with thicker skin, people who have a lot of fat in their cheeks, they tend to have a harder time getting a really good deep dimple. There's always exceptions to that, but creating that connection, the procedure itself would seem to be relatively straightforward, but yet has many technical challenges that make it not so straightforward. And I've had referrals by some very well-known colleagues in our field who would rather, who can do so many really good surgeries, but will refer the patients to me for creating dimples. So certainly it's a procedure that can be very, very gratifying and satisfying. However, we have to consider some of the risks. What are the risks? Well, when you're working on the inside of the mouth, you always have to be concerned about potential infection. So routinely we place our patients on antibiotics, and I'll irrigate the area that I'm doing the work in with antibiotic solution. And we just have to be careful about that. There's possible of an infection. There's also a possibility of issues related to taking antibiotics. So that's one risk. Bleeding is also a potential issue. So like any surgery, you have to be prepared to deal with whatever you can to prevent bleeding, and that's basically dealing with the two B's, blood thinners and blood pressure, and of course maintaining certain hygienic oral hygiene rituals after the procedure. You have to, working inside the mouth, you want to avoid hot liquids, and I try to avoid potential bacterial sources, whether it's milk products, etc. And so those things are precautions. And there is also the chance that the dimple may not be as deep as you would like, or not be in the shape that you like. And there is a limit to what that can be done, but there are times when enhancement is necessary. And that's with any cosmetic surgical procedure. Enhancements are part of that. One important variable that I have to always explain to our patients, and usually they're already aware of this since they do so much research before they come in, is that when you do a surgical dimple placement, well, the dimple is always going to be there for the first several months. What that means is there's going to be a little indentation that looks like a dimple, like you're smiling, but even when you're not smiling. And surprisingly, that's not been a disincentive for our patients who come for dimpleplasty. They understand that and they don't mind, and the feedback basically has been socially, there has been no issue, which I find interesting sociologically. Nonetheless, those are the things that I think are important to consider. As the months go by, as you get past the third month, the presence of that dimple becomes more prominent only with facial movement, be it smiling or different facial expressions. And once it's settled in, it can look very good for many years. I do advise my patients that if there is significant shifts in weight, whether it's weight gain or weight loss, that of course can have an impact on the facial fat volume, and therefore it can have an impact on the dimple. So that being said, I think it's important that if you are going to consider doing dimpleplasty, that you find a doctor who has extensive experience and expertise in this area, this niche area, and learn about their approach and style and the management, and then decide if you're comfortable enough to move forward. So I hope that was helpful. I wish you the best of luck. Thank you for your question.